Skin cancer is a major passion of mine and also a large scope of what we do. And that encompasses everything from the most common cancer in the world, which is basal cell carcinoma, to melanoma, which is one of the most deadly skin cancers and can arise from atypical looking moles. I can perform skin cancer surgery where I can remove a skin cancer, but I can also take that skin cancer that's been removed from the body, I look under the microscope, and I can make sure that the margins are clear or that the skin cancer has been removed in its entirety so that the patient has been cured. Prevention is so important. The younger people who are aware of protecting themselves from the sun will benefit long-term, but it's never too late to start. Behaviors such as wearing sunscreen every day, no matter what the weather, no matter if it's Chicago wintertime, trying to avoid the peak sun hours between 10 a.m. and 2 p.m. The more you can do on the preventative end, the easier your job will be and my job will be on the long term. I love developing relationships with people, and one of the best things about dermatology is that usually there is a longitudinal relationship. So I'll either be seeing patients once a year for their annual skin check or a few times a year for psoriasis medication follow-ups. So those relationships with the patients, their family members, is the best part of my job.